Dr. Norman Swan, we've had so many questions from people who've returned to Australia and seen what they perceive to be very relaxed processes at our borders.
One of the problems that's been throughout this whole episode so far has been contradictions, and it's unsettled the public. And we talk about the borders, closing the borders, and people's experience of that's been different. And we've seen cruise ships discharging, and it's a common story that they've got off at the airport and they just walk straight through, and they know there might be a problem, and they don't seem to be paying attention to it.
Sharon Lewin, have we simply let our guard down as far as what appears to be a trust system with people coming into the country and being told they must now self-isolate, but really leaving it up to them and not doing much further monitoring of it, if any?
Well, traditionally, in public health, we rely on trust and education of people. That's traditionally how public health works. But this is serious. It's a serious time. We're all in it together, as you heard from Paul before. And there may be a need to sort of increase the amount of observation we have with people in quarantine. At the moment, it has been an issue of trust. I still am a strong believer that's the best way to practice public health, educating and empowering the public, but we may need to increase the levels of observation because of the significance for all of the community when people don't stay in self-isolation.
What should that look like then?
Well, other countries use different techniques. Of course, most of us have mobile phones. They're easy to track. You can ring in every day. Singapore does things like get people to take a photograph of where they are and send that in to the authorities. That is a sort of, I think in 2020, that's the kind of best sort of tracking that we can do, taking advantage of electronic technology and mobile phones. One option.
Professor Paul Kelly, has that been considered? Is that an option that is before us right now?
Yes, and we're certainly learning from other countries. Singapore is a particular case in point, and I've been in touch with people in the Ministry of Health in Singapore to learn what we can from them. We're a different country to Singapore. We're different to every other country that's been facing this crisis so far. Just to add to Sharon's point there, I've been working in public health for 30 years, and during that time I've always been able to trust people once they've got the message clearly about what's required, that they will do the right thing. These are extraordinary times, however, and we're certainly looking at the powers that are available under Public Health Acts in all of the states and territories, and indeed the Biosecurity Act, which we've had a declaration of a biosecurity emergency in the last week, which gives the Minister for Health at the national level quite extraordinary powers to do things if it is deemed necessary.
But can I ask though, you began this program though by saying that you've been planning for a circumstance like this for years. Why is tracking and apps not something that you already have at your disposal?
Oh, look, there are many things that we have at our disposal, and that's one of them. And indeed, those powers that I mentioned.
You already have that technology available to you?
Well, we all have mobile phones, and location services are on mobile phones. So these are difficult decisions to make in terms of people's privacy, but I think we need to get beyond that.
Paul, you haven't introduced these technologies. Singapore has. You've had weeks now to introduce those technologies, and they haven't been done. I mean, and it's not a question of trust. We should be testing every single person that comes off one of these planes, because the asymptomatic spread is what we need to be worried about. And at least you've got a baseline, so you know when they got off the plane whether they're positive or not. You can't guess this. We have a process of testing which is only based on symptoms and contact. Symptoms, and have you come in contact with somebody, have you come from overseas? And symptoms, as we've seen with the Diamond Princess and we've seen with South Korea, are not a good sign of the people who might spread this virus. So everybody coming off a plane or a boat should be tested regardless of whether they've got symptoms or not. We need a baseline.
Sharon Lewin, do you think that's appropriate?
In an ideal world, I think it is. I think it's important to realise that there are limits to resources. We've been testing extensively in Australia, actually. If you look at the frequency of testing per 100,000 population, we're at around 480 per 100,000 population as of yesterday. and Korea, which is held up as one of the sort of best places in the world, is around 600 per 100,000.
But if
the US
with
is
respect,
about,
if we take the example of the Ruby Princess, this ship that docked in Sydney, 3,000 people on it, about 1,000 staff. If we had tested all of them, wouldn't we now be in a very different position as a country?
The Diamond, as the Diamond Princess. I think I heard you correctly. Diamond Princess, as in off the coast of Japan. Then?
No, I'm talking about this boat that came to Circular Quay last week in Sydney.
All right.
And
yes.
It's now been reported that almost 50 people are confirmed cases of COVID-19.
Yeah. Well, I was just going to. Yes. We know that cruise ships are probably quite different entities to what we know in the community. There seems to be significant spread within cruise ships, as we learned originally from Japan and then subsequently. I think cruise ships are probably a separate indication. I was talking about how we use the resources of testing and where we're going to get the best bang for our buck. At the moment, in a time where the resources are limited, we don't have unlimited testing, for example. We're doing lots and lots to increase our capacity for testing. There are new technologies on the way. There are new strategies to increase the throughput of testing. But while testing has got some limits, we need to direct it to where we're most likely to find a positive, and that is what determines the current rules around testing. However, there are new technologies, and I think we'll be able to expand our testing quite quickly over coming months. Cruise ships are another story. Others may want to talk about cruise ships in particular,
Paul Kelly,
which I think are quite different.
Are we going to change the guidelines for testing in Australia?
Yes.
When?
This week. Mostly the guidelines for testing are about include a travel component, and the travel is decreasing. I'd just like to come back to Norman's point though about what we're doing at the border. When we first put in border restrictions in relation to China, there were still quite a few people, Australians, coming from China, the very epicenter of the pandemic at that time. We actually very carefully looked at over 30,000 people coming off the planes, looking at symptoms, checks by health personnel, testing when required. 2 of them were positive. 2 out of 30,000. So that was one of the reasons why we've gone to this new way of doing it, making sure that anyone that comes in from any country must, and this is a must, and this is a message to everyone out there that's come back in this period, from any country in the world, they must self-isolate. And when I say self-isolate, it means they must stay at home. And different jurisdictions are different. But for example, in Queensland, everyone coming through the border in Queensland is getting a public health order, which they sign, saying that you must stay at home. Every person that's coming into the border, into every airport at the moment, is now having a stat deck with their phone number, their signature, their name, and those are being given to the state and territory authorities as they come off over the border. And it's up to the state and territories then to do what they feel they need to do in relation to making sure people take that message seriously.